caring for the elderly can be challenging, especially for those living with dementia. When words fail, the body speaks. Learning to read body language signs can be extremely helpful for both the caregiver as well as the loved ones. Here I'm going to share with you 5 signs that you'll notice, especially for those living with dementia and elderly in general, and what you can do for each sign in order for you to make sure that both of you are comfortable, safe, and happy. Now, the first sign is a refusing to make eye contact. Now, usually what happens is when someone has a sensory overload, especially those living with dementia, what they will try to do is to try to block out all these visual, auditory stimulus. In simple terms, they will try to block out as much distractions as possible, and everything around them is a distraction except for their own internal self-control or what they are concentrating on. For example, you might be maybe creating an artwork with your senior citizen friends, but you might be having loud music in the background, television might be turned on, the windows might be open with sounds from outside, and all these sounds, triggers will be normal to you, but to someone with dementia it's just too much to take. So what they do is they block out these external noises by refusing eye contact. So what do you do for this? Do not force eye contact. Just let them come to you. Another good way to help to let them to slowly get used to speaking to you and interacting with you during this times of too many things happening at once is to sit with them side by side instead of face to face. That way you reduce the eye contact, but at the same time you let them know that you are there for them. Secondly, slouching or making themselves smaller. This is a classic case of people feeling uncomfortable, anxious, nervous, perhaps even bored. So crouching, slouching is a method to actually protect our internal organs. It's our own coping mechanism. So if you observe someone with dementia crouching, slouching, making themselves smaller, what can you do to build a better relationship during that time? Well, the answer is to make sure that you come down to their level. What that means is, if they are sitting down, you sit down as well. Kneel down. Make sure your eye level is in line with their eye level. Speaking and observing someone who is standing up can be extremely overwhelming to someone with dementia. It's like speaking to a giant. It doesn't matter how tall or short you are, it just feels that way. So come down to their level and they'll feel more comfortable in time. Thirdly, fidgeting, tapping, or just movements that you feel might be signs of tension, nervousness, anger even. Well, fidgeting is a way for everyone to release nervous tension. So, do not force them to stop. So do not say stop it, and do not force their hands down if they are tapping something, holding on to something. What can you do to help them feel more comfortable? Here's the thing. All you have to do is provide them with something that they can actually use as an outlet to release that nervous tension. For example, if they're tapping onto the table or knocking a pen on some other surface or the walls, give them a plushie to hug, a stress ball to squeeze. If you have something a bit with less edges and safe, give them a fidget spinner. Give them a piece of paper that they can crumple. Give them a cup of coffee. Something warm in their hands will help them to cleanse, help them to warm and calm down the entire body. So, take note of that. Next, how about when they point or clench their fists? That's right. People with dementia tend to show signs of discomfort, pain even, and most of the time it could be pain. I would say 80% of the time it's an expression of pain. They do not know how to express pain in words and other actions, so they do it by pointing, clenching their fists. So not necessarily being angry with you. They are in pain and do not know any other appropriate ways to express their pain. So, what do you do in such situations? That's right. Sit with them and ask them, let me check on you and see if there's a way to make you feel more comfortable. And you check whether they need a change of clothes, whether there's some blisters on any part of their body that they're lying on or sitting on. For example, there might be rashes. So any sign of pain or discomfort is usually displayed in gestures that you might mistaken for as anger. It might just be pain and frustration. Fifth is pacing up and down. So our seniors and those suffering from dementia usually do not really know a way in which they can express when they need to use the bathroom, or that they are feeling hungry or thirsty. So the body finds ways in which to try to display this need. And how do they go about doing this? By pacing back and forth to ease the tension in their bellies and your overall senses. So they pace up, back and forth. So it's always good to check with them. Do you need to use the bathroom? Are you thirsty? Or are you hungry? When I was helping out with a course in one of the nursing homes, they found out, they meaning the volunteers and caregivers in the nursing home, found out that 80% of their patients who pace back and forth were actually having discomfort with their tummy and bowel movements. So generally it's just discomfort. So take note of that. So when you have your loved ones or you are caregiving seniors, and even those who are not seniors but suffering from dementia, take note of all these body language, because most of the time words fail to express how they truly feel. And by recognizing the body language cues, you can be a much more effective caregiver. Now, remember to also take care of yourself so that you can take care of them well. Share this video to caregivers who you feel might find these tips useful. Remember, they are not trying to be difficult. They are just trying to reach out for help. So don't be too hard on them. At the same time, don't be too hard on yourselves as well. Take care, and I'll see you in the next one. In the meanwhile, do enjoy the animated video. It's fun, but yet there are educational tips in there that will stick due to the visuals. Have a look. See you next time.
Hey caregivers! Did you know your patient's body is talking to you, but it's speaking in secret code? Let's crack the code. Sign 1, no eye contact. It's not rudeness, it's overload. They're saying, too much noise. Lower the volume. Speak softer. Sign 2, slouching. They are making themselves small. Don't stand over them like a giant. Get low. Kneel. Be their equal. Sign 3, rocking or fidgeting. This is stimming. It's like a stress shake. Don't. Sign 4, pointing or fists. Don't argue. They aren't mad at you. They are in pain. Fix the body, fix the mood. Sign 5, pacing. They aren't running a marathon. It often means need the bathroom or I'm thirsty. Check the basics first. Danger zone! Never correct a person with dementia out loud. It breaks trust. Instead of shouting, we suggest, remember, they aren't giving you a hard time. They are having a hard time. Be the calm in their storm. See you next time.